Hello guys, welcome to our first Do I Suffer session. The topic for our session today is dedicated to pancreatitis. We're gonna briefly review the function of the pancreas. As the video goes on, I will guide you through the causes, the mechanism of pancreatitis, the symptomatology, the diagnosis and the treatment. In the last part of the video, we're gonna list some of the complications as well as the sequel of pancreatitis. Hopefully you like this video and subscribe for upcoming sessions. Do I suffer from pancreatitis? What is pancreatitis? What is the pancreas? Pancreas is one of the internal organs and has endocrine as well as exocrine functions. The endocrine function is the production of somatostatin, insulin, and glucagon, and is released into the blood. The exocrine, it aids in the digestion and absorption of macronutrients. Now, how is it caused? We have intrapancreatic activation of enzymes. This means that the enzymes are activated inside the pancreas. Inactive trypsinogen is converted into the active trypsin, which will increase the activity of proteolytic and lipolytic enzymes, leading to the destruction of the pancreas. Why is it caused? What is the etiology? Accounting for 60% of the acute pancreatitis, meaning the gallstones, and 20% of the cases is caused by ethanol, so alcohol. Other causes include idiopathics of unknown etiology, trauma, steroids, viral infection, mumps, autoimmune causes, scorpion poison, hypercalcemia, hypertriglyceridemia, and hereditary causes like cystic fibrosis, ERCP, and drugs such as statins and loop and thiazide diuretics. Moving on, the symptoms. So, the patient will describe pancreatitis with constant severe pain, most of the times described as 10 out of 10, and this pain radiates to the back. It gets worse when supine or after meal and improves when leaning forward. Other symptoms including fever, nausea and vomiting. On examination, the abdomen will be distended. Free fluid can be found using ultrasound or other imaging methods, and signs of shock such as decreased blood pressure, increased heart rate, oliguria or anuria. Other symptoms and dermatological symptoms, it's the Fox sign, it's a chemosis on the inguinal area. The Cullen sign is a chemosis on the periumbilical area, and Great Turner sign is a chemosis on the flank area. Diagnosing pancreatitis. Apart from the patient history and the clinical examination, which are all of vital importance, the laboratory values that can help us is the increase, which can be a cause of pancreatitis, or decrease of triacylglycerides, increase of inflammatory markers such as white blood cells, CRP, procalcitonin, and sometimes if measured interleukin 6, increased serum lipase and amylase 3 times above the high normal levels, and increase of urine amylase. On diagnostic imaging, CT scan with IV contrast medium and MRCP can show the cause. Now that we found out how is the pancreatitis caused and we diagnosed it, important part of the clinical practice is the treatment. So, we give the patient IV fluids, nil by mouth, he is not allowed to eat anything, analgesics due to severe constant pain as discussed, ranging 10 out of 10, therapeutic ERCP in cases of biliary pancreatitis caused by gallstones, and finally antibiotics are not administered. As we discussed in the beginning of this first session, we're gonna go through some of the complications of pancreatitis. We can see here superinfection, pseudocyst abscess formation, sepsis, disseminated intravascular coagulation, and acute respiratory distress failure, and the sequel of pancreatitis. So how does the pancreatitis progresses is a capillary linkage, which will lead to undistributive type of shock presented with decreased blood pressure, increased heart rate, oliguric patient or anuric patient, hypocalcemia due to saponification of peripancreatic and mesenteric fat. In the beginning, we said that one of the causes of pancreatitis can be hypercalcemia, which will finally lead to hypocalcemia, as we can see here, and this is the etiology, and pancreatic necrosis. Thank you guys for those of you who make it to the last part of this video. Hopefully you enjoyed it. Please hit that like and subscribe button. See you on the next Do I Suffer session.